NCLEX Crash Course Seizure Types Simplified. Generalized seizures equals whole brain is affected. Partial seizures equals only one part of the brain. Generalized seizures equals loss of consciousness is common. Types: tonic-clonic, muscle stiffening, jerking absence, brief staring spells. Often in kids: myoclonic, quick muscle jerks atonic, sudden loss of muscle tone, think. Drop attacks. Partial seizures equals can be simple or complex, can be simple or complex, simple partial, no loss of consciousness. May have twitching, tingling, or visual changes. Complex partial, altered awareness. Repetitive movements like lip smacking or hand wringing. NCLEX tip: general equals loss of consciousness. Partial equals may remain aware. NCLEX-style questions on seizures. 1. A client with epilepsy has a tonic-clonic seizure. What is the nurse's priority action during the seizure? A. Insert an oral airway. B. Restrain the client. C. D. Administer oral medications. Correct answer: C. Turn the client to the side. Rationale: turning the client prevents aspiration. Never insert anything in the mouth or restrain during a seizure. 2. A client suddenly stares blankly for a few seconds and is unresponsive to questions. What type of seizure is this? A. Tonic-clonic. B. Atonic. C. Myoclonic. D. Absence. 3. Which of the following indicates a simple partial seizure? A. Loss of consciousness with muscle jerking. B. Sudden collapse without warning. C. Twitching of one arm with full awareness. D. Staring blankly with lip smacking. Correct answer: C. 4. The nurse is teaching a client about phenytoin. Which statement indicates the need for further teaching? A. I will brush my teeth regularly. B. I can stop taking the drug if I feel better. C. I should avoid alcohol while on this medication. D. I'll report any skin rash to my doctor. Correct answer: B. I can stop taking the drug if I feel better. Thank you for watching. I truly appreciate your support.